Okay, so for the first surgery to describe as part of the series, we're going to talk about upper blepharoplasty, also known as removing excess upper eyelid skin. So the most important part, if anything, is always your preoperative consultation. So for a consultation for an upper blepharoplasty, the first thing that we're going to evaluate is one, is your brow in the right position. If the brow is in the right position and the brow is not too low, then we'll discuss, okay, is there too much skin in the region of the upper eyelid? Is there excess skin? Is there also a pooching of the fat? And is there a thickening of the muscle there? More commonly than not, it's usually a skin and fat procedure or skin only procedure. So that's really important in the preoperative consultation. Also in the preoperative consultation, we'll determine if you do have excess skin there. By doing so, we'll take a forcep, we'll pinch that upper skin and make sure that there's excess skin and that you're going to get a great result. You also want to remove enough skin so you do get that beautiful result to look rejuvenated, but you don't want to cut out too much skin where you're left with a complication of not being able to close your eye. So it's a very, very precise measurement to determine how much upper eyelid skin are we going to take out during this procedure. So now that we've talked about a little bit about the consultation, we can go over a little bit of anatomy that's relevant to the upper eyelid. So again, you have that excess skin in the patient desiring the blepharoplasty. And then we're going to have two fat pads. So one medial fat pad, and here right next to it, joined together there, you could see is on the photo, is the middle fat pad. Farther right, that brownish looking structure is the lacrimal gland, which is going to be responsible for producing your tears. More commonly than not, with this procedure, we're going to be removing sometimes skin only and sometimes a little bit of the medial and or middle fat pad. Sometimes just one of them, sometimes both. Again, it varies per patient. And that skin removal is going to be precisely determined during your consult and immediately right before the surgery as well. After the skin, excess skin is removed, we close the incision with sutures, and those are generally removed 5 to 7 days after surgery. And it's a very well tolerated procedure, and in this procedure alone can be done very easily under local anesthesia in the office.